Welcome to Module 6, Allergic Asthma Triggers. In this module, you will learn how to describe what an asthma trigger is. You will be able to list the different types of allergic asthma triggers. Asthma triggers are a substance or condition that can cause airway inflammation or airway constriction and bring on asthma symptoms. There are various types of triggers that don't affect every asthma patient in the same way. It's important for you or your child to know your specific asthma triggers so you can try to avoid them. There are allergic and non-allergic asthma triggers. This module will talk about allergic asthma triggers. Please take a few minutes to also watch Module 7, which talks about non-allergic triggers. Allergens can cause the body, including the lungs, to have an allergic reaction. Irritants can lead to asthma symptoms but do not cause an allergic reaction. Allergens are something that causes the body to have an allergic reaction. Allergens are a substance in the environment that, when inhaled, can cause an immune reaction in the lungs, which causes swelling and mucus production. Although different people are allergic to different things, some allergens are more common than others. We'll review information about some of the most common allergens that are asthma triggers. Specific indoor allergic asthma triggers include dust mites, pets, cockroaches, rodents, and mold. Dust mites are tiny. They are found in most homes in the United States. Dust mites prefer more humid and warm temperatures. Mites live in upholstered furniture, carpets, and bedding. Dust mites can also live in stuffed animals. Loose pile carpet can also be a habitat for dust mites. Dust mites are the most important indoor cause of allergies that can trigger asthma. About 2/3 of people with asthma are allergic to dust mites. Dust mites are found in every home in the Pacific Northwest, no matter how clean the house. Getting rid of the dust mites or reducing their numbers, especially in your bed, can be a big help in controlling asthma for people who are allergic to mites. In some cases, mite reduction methods can eliminate all asthma symptoms. Dust mites are best controlled by using multiple methods, and the main focus area should be your bed. Use allergy control covers for mattresses and pillows. Wash bedding materials weekly at 130 degrees to kill dust mites. Dry bedding outdoors on sunny days or in a hot dryer. Minimize stuffed toys. Wash them weekly or freeze them. Dust and vacuum regularly using a HEPA vacuum. Control humidity in the home. Pets can make asthma worse for people with pet allergies. All warm-blooded animals such as dogs, cats, birds, guinea pigs, gerbils, and others produce substances in their fur or feathers and saliva that can cause allergic reactions. For people with asthma over 5 years old who have a known pet allergy, pets such as fish or reptiles are better. For those with a known pet allergy, the best thing you can do is keep the pet out of the house. However, that may not be possible or desirable. At least try to keep pets out of the bedroom of the person with asthma and keep that person's bedroom door closed. A HEPA air filter in the bedroom can help remove pet allergens from the air. If possible, keep the pet out of the play area of a child with asthma. Vacuum bedroom and cloth-covered furniture twice a week and other rooms and cloth-covered furniture weekly. Use a sticky lint roller brush to remove pet hair from furniture if vacuuming doesn't remove it all. Put a pet blanket over your pet's favorite spot and wash the blanket weekly. Removing carpet, drapes, and cloth-covered furniture will help because these collect the triggers that come from pets. Bathe pets often and wipe your pet's feet upon entering the home. Cockroaches are common indoor pests found in all types of homes, especially in warm, humid climates. Many homes have roaches, no matter how clean they seem. In addition to just being creepy, Roaches can be an allergen source and an asthma trigger for you or your child. Cockroach allergen is known to come from feces, saliva, and the bodies of these insects. Getting rid of roaches from the home can help control asthma if you are allergic to roaches. It's important to figure out why there are roaches in the home in order to help get rid of them. Cockroaches prefer a moist, warm habitat. Cockroaches are usually found when food is not stored properly in sealed containers, in food waste, and in unwashed, accessible dishes. Roaches need water, so may be found where there are leaks or condensation. Cockroach control may become a difficult task because of the time and special knowledge it often involves. They do not bite, but they do have heavy leg spines that may scratch. Roaches live in colonies, so if one brings back insecticide, it can kill the others. It is important to eliminate cockroaches from the entire home. Start with the kitchen and bathroom. For additional information on cockroach removal, see the materials linked under this module. Rodents such as mice and rats are another common allergic asthma trigger. Exposure to mouse urine and droppings can trigger asthma attacks. Rodents are a persistent problem in many homes. Rodents, especially mice, are often found in homes more often during colder months when they come inside to stay warm. You may find out you have mice if you see droppings. They are attracted by food, water, shelter, and warmth. Rodent control strategies include eliminating food sources with storage of food and collecting and disposing of garbage, eliminating breeding and nesting places by removing clutter near the home, including excess lumber, firewood, and similar materials, and killing rodents with the help of a family cat or having someone apply rodenticides. If cats aren't an allergen to the person with asthma, they can be effective against mice. An important key to pest management is to remove places in the home for pests to hide and to eliminate sources of food and water. But remember, pesticides you may spray to prevent pests are not only toxic to pests, they can harm people too. Try to use pest management methods that pose less of a risk. Mold can also be an allergic asthma trigger. Molds are part of the natural environment. Outdoors, molds play a part in nature by breaking down dead organic matter such as fallen leaves and dead trees. But indoors, mold growth should be avoided. Mold can cause health problems when inhaled or touched. Molds reproduce by means of the spores. The spores are invisible to the naked eye and float through the outdoor and indoor air. Mold may begin growing indoors when the mold spores land on surfaces that are wet. Mold can develop in water-damaged materials such as carpet or furniture. It's important to remove or dry out wet carpet and furniture. Module 8, Indoor Air Quality, contains additional information about how to clean mold. It's important to look for moisture in the home because mold needs water in order to grow. Condensation on windows and walls is a sign of high moisture levels. Common sources of moisture in homes include plumbing leaks, such as under the kitchen sink or in a bathroom. If the wallboard is mildly damaged with water, it is best to replace it. Here are some other common places to find mold. Bathrooms and kitchens without adequate ventilation. Vapor from showering and cooking. Dryers not vented to the outside. Leaks in the roof, walls, or windows. Dampness from crawl spaces or basements. If the kitchen or a bathroom does not have a fan or a window, an exhaust fan should be installed. If possible, the fan should have a relative humidity rheostat switch, which is a switch that turns on the fan when the humidity goes above a set level, or have the fan set to a timer switch. Timers can be used with bathroom fans but not with kitchen fans. Another option for bathroom fans is to use a fan that is always on at a low and quiet flow rate. If no fan is available, open the window when showering or cooking. To further reduce moisture allowed into the home, a vapor barrier should cover the entire crawl space. Crawl spaces should also be ventilated. Repair any leaks and vent the dryer to the outside. Any holes between the crawl space and home should be plugged using steel wool and easy foam. A concrete floor can pick up water from the dirt beneath it. If the floor is to be covered with carpeting, a vapor barrier, non-porous plastic sheeting, should be placed between the carpet and concrete to prevent moisture from entering the carpet. If you don't put down a vapor barrier, the concrete will make the carpet damp and encourage mold growth. It's better to paint the concrete floor and use area rugs. Excessive moisture and humidity can cause problems for children with asthma by helping mold, dust mites, and cockroaches grow and multiply. Exposure to some molds, dust mites, and roaches can cause asthma or can trigger asthma attacks. There are simple things that you can do to reduce the moisture level in your home. Along with indoor allergic asthma triggers, there are also outdoor allergic triggers. Spring and summer can bring asthma attacks to individuals who are allergic to pollens. Trees, grasses, and weeds are major sources of pollen allergies. People may inherit a tendency to be allergic. Asthma attacks may recur each year during a pollen season, depending on your specific allergies. If you know your asthma is worse during certain times of year, make sure you are taking controller medicines for both asthma and allergies. Though long-acting antihistamines taken by mouth may be helpful, nasal steroids work best. If wheezing, shortness of breath, or other asthma symptoms accompany the signs of allergies, sneezing, itching, and watering eyes, nose, mouth, and throat, medical attention to control allergies is needed. Approaches to treatment of pollen allergies include avoidance of the allergen, medication to relieve the symptoms, and injection treatments, allergy shots. Use of allergy shots is usually managed by an allergist, not a primary care provider. It's important to know you or your child's asthma triggers so you can avoid them. Allergens cause the body, including the lungs, to have an allergic reaction. Irritants can lead to asthma symptoms but do not cause an allergic reaction.